Welcome to our discussion on the new WHO pandemic agreement. This treaty, finalized in May 2025 after intense 3-year negotiations, is stirring up a lot of debates on both global health and sovereignty.
I'm excited to dig into this. It seems, well, it's like a Pandora's box of provisions, right?
Absolutely. It's like there's so much in the document, from revamped early warning systems and coordinated international responses to some pretty deep concerns about national sovereignty.
Right. So, on the surface, it's aimed at boosting global preparedness after, well, a massive crisis like COVID, isn't it?
Yep, that's the idea. The treaty proposes expanded surveillance systems, sharing of medical resources, and an empowered WHO, granting emergency declarations and binding recommendations.
Yes, indeed. But then there are these hidden layers. For instance, the US notably abstained from the final negotiations. That really raises eyebrows.
Exactly, and it's kind of like the US never just bowed out without reason. Officially, it's about constitutional concerns over sovereignty. Yet insiders suggest that American intelligence flagged some dangerous, problematic clauses.
That's interesting. Right. It makes you wonder. Were those concerns purely about national pride, or is there an actual risk of a massive power grab?
It's a bit of both, really. The agreement grants WHO officials the power to declare a public health emergency unilaterally. Imagine that. One person or a small committee deciding on global measures without full member state oversight.
Yeah, that's kind of scary. And then the treaty also lays out these response mechanisms, like mandatory reporting and extensive digital surveillance. It's like the world is stepping into a real-life science fiction scenario, isn't it?
Exactly. It's like a digital control grid is being woven across nations with real-time surveillance hubs, mandatory health certificates, and centralized data repositories.
Okay, I follow. But here's a question. If the agreement is intended to improve global health responses, why are these surveillance provisions so, invasive?
That's the crux, isn't it? While the early warning system is vital, the same network that tracks pathogens also tracks people. The data is stored in a WHO-controlled database with minimal oversight, leaving privacy concerns wide open.
Yeah, indeed. And then there's the issue of enforcement. The treaty apparently comes with financial and diplomatic penalties for nations that don't comply with WHO directives, which might limit national discretion over public health.
Exactly. It shifts a lot of power from individual nations to a centralized global body. That's a sharp pivot in how international relations have traditionally worked.
That's a big shift. On top of that, there's a real concern over censorship. A clause aimed at combating health misinformation could, if misinterpreted, potentially suppress legitimate debate, right?
Yep, Article 24 is particularly concerning. It basically gives governments the mandate to block content determining what counts as misinformation. That could easily slide into suppressing dissent or even suppressing innovative scientific critique.
Yeah, that's definitely a slippery slope. I mean, if you think about it, while preventing false information is important, who gets to decide what is false can be extremely subjective, especially in a rapidly evolving public health context.
Absolutely, it's a balancing act. But under this agreement, WHO essentially defines the parameters, which poses risks for free speech and scientific debate.
I see your point. And what about the influence of external powers? There's talk about China's significant role in shaping the treaty. I find that particularly intriguing.
Indeed, the treaty's texts have echoes of Chinese policy language, and several key negotiators had ties to Chinese research institutions. Also, with China's role as a major financial contributor after US funding cuts, it's almost as if the treaty is also a chess piece in global power politics.
Right, very concerning. Which leads us to the conflict of interests, the involvement of industry executives, pharmaceutical firms, and tech companies in drafting these provisions. That revolving door seems to be a recurring theme.
Exactly. There's this undeniable blending of public health needs with massive financial stakes. The treaty channels billions towards certain companies, and the selection criteria for authorized suppliers remain shockingly opaque. It's like The rules were written on the
I
back of
hear
a
you.
napkin, yeah?
Now, on a more challenging note, some argue that this could be seen as a necessary consolidation for global health. But isn't it a bit drastic to implement a global governance structure that can override national policies?
That's a really good point. While international cooperation is needed to tackle pandemics, the treaty's potential to override national sovereignty is alarming. It basically means that during emergencies, national governments might have to cede control in ways that are hard to reverse even after the crisis passes.
Yes, that's the crux of the debate. I have to question one thing though. Could it be that some of these measures, though extreme, are designed out of necessity to handle global crises better? I mean, isn't the idea to prepare for the worst case scenario?
Sure, one could argue that, but it's like the potential for abuse is real. A system with indefinite emergency powers and minimal oversight opens the door for unaccountable decisions. The risk is that temporary measures might silently become permanent fixtures in governance.
Yeah, that's a fair critique. And what about the redefinition of key terms? Expanding pandemic to include non-infectious crises or broadening vaccine to include various prophylactic interventions seems to set up almost any health measure as mandatory.
Exactly. By redefining pandemic, vaccine, and even misinformation, the treaty not only broadens its scope, but also widens WHO's discretion. This is a clever, albeit risky, linguistic maneuver that could have huge implications down the
Absolutely.
road.
It really sets a precedent for crisis-driven policy changes, doesn't it? Historically, emergencies have given governments extra power, but here, it's on an international scale.
Right, it's like the historical patterns we've seen, from quarantine in medieval times to modern surveillance. It all builds to this moment, where a global treaty could redefine public health governance permanently.
Yeah, exactly. I find it interesting how the treaty also ties into digital control. The mandatory digital health certificates and integrated systems with financial networks sound awfully like a global social credit system.
Yes, it's like we're being nudged toward a future where our movements, our health status, even our data privacy are all interlinked under one massive surveillance apparatus. The idea is to monitor pathogens, but it's equally set up to monitor individuals.
That's a real concern. And then there's the issue of accountability. Article 32 effectively provides legal immunity for WHO officials and corporate partners during emergencies, meaning affected individuals might have no recourse if things go horribly wrong.
Exactly, it's like a legal shield safeguarding potential missteps. No judicial review in national courts makes it incredibly difficult to hold anyone accountable.
Yeah, that definitely sounds problematic. There seems to be a pattern here, a convergence of concentration of power, lack of oversight, and the blending of health with digital control and financial incentives.
Precisely. And beyond the legal and structural issues, there's also an undercurrent of potential population control. Some critics claim that, while not explicitly stated, the treaty opens doors to demographic targeting and interventions.
Yes, I've seen that argument too. It's a fiery mix of public health necessity and, well, potential for authoritarian overreach. I mean, can we really tell if the intention is purely about saving lives or if there's an ulterior motive?
That's the million-dollar question. Whether it's engineered crises being used as a pretext for consolidating power or an overblown response to global health needs, the uncertainty itself is alarming.
Definitely food for thought. I do wonder, though, if there's any middle ground here. Aren't there avenues to reform these provisions rather than discard international cooperation altogether?
Absolutely. There is room for improvement. For instance, more robust oversight provisions, transparent selection criteria for suppliers, and clear sunset clauses for emergency powers could help balance global readiness with individual rights.
Right, that sounds like a more sustainable approach. It almost seems like the treaty, in its current state, represents an extreme vision of global governance that might be too concentrated and original, almost like a blueprint for future centralized control.
Yes, and it's a wake-up call for citizens around the world. The debate isn't just about managing pandemics, but about ensuring that public health measures don't morph into systems of perpetual surveillance and control.
Exactly. In the end, it's crucial that the public stays informed and that governments insist on democratic input before ceding such large-scale powers to unelected international bodies.
And that's the key takeaway. Awareness and activism are the best defenses against any overreach. Thanks for diving into this with me. It's been quite an enlightening conversation.